On rollout of the COVID-19 vaccine gathered steam on Wednesday morning in the country, with long queues being witnessed at various health facilities tasked with the administration of the jabs. The rollout that comes as a sigh of relief to thousands of Kenyans who until earlier this week had remained in the dark as to whether they will receive a second shot in the arm follows the arrival of 358,700 doses of the AstraZeneca vaccine from Denmark on Monday night. David Mudhoka begins our broadcast tonight.
For the better part of Wednesday, long queues were the order of the day at the Gotv County Hospital in Nairobi as the administration of the second and final shot in the arms of Kenyans who were partially vaccinated picked up pace. The second round of vaccination that had ground to a halt until earlier this week following a vaccine scarcity crisis will see up to 358,700 Kenyans who had hitherto received their first dose and were due for the second one receive a shot in the arm. Hopes for a second dose were ignited following the arrival of a consignment of doses from Denmark, even as the country grapples with a low uptake of the second dose. As of Tuesday, the uptake was at 19.5%, meaning that just 194,475 Kenyans out of the 996,414 who received their initial dose were fully armored in the raging war against COVID-19. That number is, however, expected to tremendously grow in the coming days if today's shift in the jab uptake tide is anything to go by, with the government keen on administering 50,000 doses a day.
The first one is to protect yourself from the virus. Then the second one will be to protect others from the virus. So I think it's very important.
Nilikuwa na hofu kwa sababu Minister of Health walikuwa wamesema kwa hizi chanjo haziwezi changanywa. So nilikuwa na jinsi pengine kutakuaje, na niliposikia kuwa ishara ya pili imekuja nilifurahia.
Alive to the fact that its doses arsenal could be depleted in the coming days, and with the Danish consignment termed a mere drop in the ocean, officials from the Ministry of Health have since trained their guns to other countries dishing out vaccines to acquire more doses. Out of the countries is the United States, which has since included Kenya in its list of beneficiaries in a 14 million Pfizer vaccine shipment.
I'm confident even what we got 1 or 2 days ago will quickly be deployed and will yearn for more doses to come.
This as the Council of Governors Chair Martin Wambora called for the equitable share of the vaccine doses at a time when counties from the Lakeside region continue to bear the heavier brunt in terms of COVID-19 transmission alongside Nairobi.
Who have the capacity, who have the funds, they have to liaise with the Ministry of Health, MOH, and also KEMSA, the newly constituted KEMSA.
The country is now expecting to receive an additional 182,000 doses later this week. Barely days after the second round of COVID-19 vaccination in the country received a shot in the arm, the Ministry of Health now risks running out of COVID-19 jabs in the coming hours or days should it not acquire more batches to bolster the war on COVID-19. David Mudhoka, TV 47 at the Gotv.